Right now in Tennessee, the Centers for Disease Control labels the state a low transmission state for COVID-19. You see, all but 4 counties are green, with only yellow or medium ones in West Tennessee, in middle parts of the state as well. But as 10 News reporter Grace King explains, health leaders in East Tennessee are seeing a rise in cases. Grace?
John, right now the health department is reporting about 70 new cases a day. That's up from about 45 cases a day 2 weeks ago. It may not seem like a lot, but the Knox County Health Department says that's just the tip of the iceberg because at-home tests are becoming more popular.
It's not a true reflection of the burden of illness in our community. But if we are seeing those numbers increase, it makes sense that those numbers of at-home tests or tests that aren't being reported to us are increasing as well.
That's why health leaders are using hospitalizations as a benchmark. In East Tennessee and across the state, they're starting to slowly increase.
That comes from people who previously were unvaccinated or didn't complete their vaccination series, people who didn't get a booster.
Most cases they're seeing are mild.
If you have signs and symptoms of a cold, if you have a runny nose, a fever, anything along those lines, don't chance it. Take a test, take an at-home test, call your provider. You can come here and get tested as well.
If you're immunocompromised or high risk, Dr. William Schaffner said it's probably time to start wearing a mask.
This virus hasn't disappeared, and if you're at risk of severe disease, please be cautious while you're having fun.
And again, those hospitalization numbers are rising, but they're nowhere near as high as previous surges. And health leaders hope they'll stay down there and not up there like before. John.
Grace King with some perspective tonight. Thank you, Grace. Let's